able-bodied male workers, males, who refuse to get a job, who refuse to even meet the minimal thresholds that President Trump has demanded, that they be looking for a job, that they be getting education.
Excuse me, Secretary. That's rhetoric, not reality. You're going to have 10 million people without health care. They're going to the emergency rooms. It is going to undermine the health care system in every state of this country, and you'll be responsible along with the President. Thank you.
Mr. Secretary, I want to ask you about the CDC's childhood-led program, because we've heard a lot of conflicting messages about
Childhood?
Yes, the childhood-led poisoning prevention program. But we've heard a lot of conflicting messages. First, the program was eliminated as part of your restructuring of HHS, and all the program staff was fired. You suggested that that was a mistake and that the program will be brought back online. Last week, you told Senator Baldwin that lead poisoning among children was a very significant issue, and if Congress appropriated the money, the program would continue. Well, Congress has appropriated the funding, and as far as we can tell, staff has not yet been hired, and I see no statements reversing your decision to eliminate the program. So which is it? Do we have a program?
We are continuing to fund the program, and in Milwaukee, we have a team in Milwaukee, and we're giving laboratory support to the analytics in Milwaukee, and we're working with the health department of Milwaukee.
Well, that's Milwaukee. What about the rest of the country?
Well, I don't. As I said, I have a TRO now. You know, a federal TRO that does not allow me to talk about the reorg. What I can tell you is that if you appropriate the money, that we are going to spend it.
We have appropriated the money, Mr. Secretary. You indicated that you have a program in Milwaukee. What about the rest of the United States? This is not a problem exclusive to Milwaukee.
My understanding is that that program is continuing. I'm hoping to. I'm very, very happy to talk to you, Senator, after this and find out exactly what the details are.
Well, it should be a very simple answer. The program's back up and running. We've hired the staff, which I don't think you have, and that doesn't indicate that you're serious about getting the program running again. I just want to put a word in to second Senator Collins' support of the LIHEAP. It's a program that is incredibly important to people all across the country. Cold winters, torrid summers in the South, people need it. And I support her comments very much. Now, let me turn to an issue, Medicaid. The Nonpartisan Congressional Budget Office estimates that more than 10 million people will lose access to Medicaid because of the bill under consideration right now in the House. In fact, CBO didn't even get to score all of the Medicaid provisions, so it could be higher. But the consequence of that is millions of people losing Medicare will mean that many more people will go to the emergency rooms because they don't have a doctor. Many community health centers will close because that's the margin that keeps them open. Nursing homes will likely close. In fact, frankly, it will probably undermine significantly the healthcare systems in every state in the union. So why are you making these cuts?
First of all, we haven't made cuts. We've only in Washington would those be called cuts. The reductions that are proposed are reductions in the rate of growth over the next 5 years. And those reductions are to eliminate waste, fraud, and abuse. And I'll explain to you, there's 1 million people now on Medicaid who are accepting Medicaid, or collecting from Medicaid in 2 states. That's illegal. They're stealing from the Medicaid program. We've now been able to identify them, which no other administration was able to do. There are 2 million people who are collecting both Obamacare, or 1 million people who are collecting Obamacare and Medicaid. That's illegal. It is also a theft. There are 1 million illegal aliens in the states that have allowed that, like California. And as soon as we made the announcement that we are not going to allow that funding anymore, Gavin Newsom followed by making his announcement that he's not going to fund it anymore. So his compassion ended where he had to start paying for it. The remaining, and there's only 8.5 million people affected by this. The remaining people who are affected are able-bodied male workers, males, who refuse to get a job, who refuse to even meet the minimal thresholds that President Trump has demanded, that they be looking for a job, that they be getting education.
Excuse me, Secretary. That's rhetoric, not reality. You're going to have 10 million people without health care. They're going to the emergency rooms. It is going to undermine the health care system in every state of this country. And you'll be responsible along with the president. Thank you.